Now
Now?
I think so. It says we're on live.
Great.
Up in the yes.
Hi, ladies. We had more technical difficulties, but in some women, hormone therapy can increase the risk of cancer. It can increase the risk of stroke and blood clots. Hi, I'm Trish Gleason, and we're fortunate today to have Dr. Paul Finucan here with us from Naples, Florida. Hi, Dr. Finucan, how are you?
Hi, Trish. Thanks for having me on your show today.
Great. Well, I'm going to ask you a few questions, but before I do, let me go ahead and tell everybody a little bit about you and your history. 37 years, Dr. Finucan's been a doctor. He's a chiropractor, an acupuncturist. He's a sports injury specialist and a clinical nutritionist. So we'll definitely have him come back to talk a little bit about weight loss at another time. He's the owner of Alternative Health and Healing and also Weight Loss Done Right. There, I think you're on Tamiami Trail down there in Naples, Doctor.
Yes.
Is that correct?
Yes, we are.
Okay,
we've been in the area 35 years, and before that, Michigan and Illinois.
Okay, great. Well, I also heard through the grapevine that you are the doctor for some of the top athletes here in America. Is that true?
We love working with sports injuries and helping athletes perform better. So we do work with a lot of professional athletes. We've worked with the Olympiads and so forth. Here in Naples, a lot of golf and tennis professionals, but just a lot of people that love sports as well. So it's a great place to have a practice for sports injury.
Okay, well, we're privileged to have you here today. As I mentioned, hormones in general can cause us a lot of trouble, and all of our life, I know if I'm speaking for the women, at least the 900 in our Facebook group and thousands of others, we want to know really, truly from an expert, what exactly is hormone therapy and what can we do to help ourselves?
Sure. Well, we take a natural approach. There's medical hormone therapy with drugs and actually giving actual hormones in injection or tablet or in different formats that they're provided as a medicine. We try to do a natural approach using clinical nutrition to help the body build and balance its own endocrine and hormonal system. So the nutritional approach is the best approach if it can be done.
So you're saying that you, when you have people come in your clinic, you teach them what to eat to balance out all the stuff they take?
Yeah, healthy diet can have a great effect. But also there's specific nutrients that help the adrenal gland, the stress gland, which is a backup for the hormonal system. And there's nutrients that help a woman's female system, uterus and ovaries, produce and balance hormones, men testosterone. So there are nutrients that help correct or keep the organs healthy so the body balances its endocrine and hormonal system. So there's a medicine for that treats the symptom, and there's a nutritional protocol for that helps correct the body. So
I see. So what you're saying is you don't really have to take the medicines. There's always an alternative that's healthy in replacement?
Well, there's not always a replacement for medicine. If a woman has no ovaries with a hysterectomy, they may need some hormonal replacement. Then we try to have them do bioidentical hormones, and then we often can help balance with nutrition and diet so that they maybe need less hormones or their body functions or feels better, responds better. So there are some necessity for medicines, but we'd like to use the least amount as possible.
Mm-hmm. What can we do about all the hormones in meat? And I don't know, maybe there's hormones in other plants. Plants instead of animals.
Well, of course, things like soybean has a lot of estrogen. There are certain foods that are higher in hormones, and some people like to have yam. Yam is a natural source of progesterone. But as far as when they give cattle or animals hormones to put weight on them, some of those hormones remain in the food we eat. So you want to try to get range-free produce, hormone-free, antibiotic-free. So you want to try to pick healthier, cleaner foods when possible.
It'll just say that on the label?
Well, a lot of health food stores, particularly, even some of the main stores now, will say hormone-free, antibiotic-free, range-free, organic. So we try to look for a better quality food. And if it doesn't say it, it may contain or likely to contain some antibiotics or hormones. So we try to look for a better quality food source.
Okay. You know, one of the things that comes to mind for me, being a woman, is osteoporosis. Does hormones have anything?
Definitely.
Mhm.
Yes, estrogen and progesterone, the women's hormones, help with healing and repair and help with bone density. So women after menopause are at a higher risk for bone density problems, osteoporosis or osteopenia. Again, we'll use nutrition and therapies that increase the density of the bone, and light exercise with weights can help stimulate bone density. So we use magnetic therapy to help bone density. But again, we want to balance the hormones. If there's a lack of progesterone or estrogen or hormones, women are at higher risk of bone density, higher risk of not healing and repairing. And of course, it affects your mood and your energy and your libido. So many things are all regulated by our hormones.
Okay. So, like, if you were going to recommend 3 foods that we should eat that will help our hormones, what would those 3 foods be?
Well, as far as, like I said, choosing, the range-free foods would be the
Okay.
first choice.
Okay.
So
Range free.
if you're gonna have beef, yeah, range-free, hormone-free, chicken or turkey or beef, so you can get those better quality. Of course, fresh wild-caught fish. I'm not particularly good liking farm-raised fish, but there's a lot of good foods, and of course, lots of fruits and vegetables, and again, organic when possible.
Okay, great. So I did a little bit of homework and printed off a few things that talk about hormones. And for some reason, they're bringing up vitamin D levels and cholesterol and triglycerides. Does that have anything to do with
Well,
hormones?
cholesterol is a building block of hormones, and so many people are being put on cholesterol-lowering drugs. And the cholesterol is, without cholesterol, we wouldn't be alive. So cholesterol is a building block of hormones, a lot of repair in the body. So if cholesterol is lowered too severely, it actually can be detrimental. Vitamin D is very important for bones and so forth. But vitamin D is another building block. So we need a balance of all our vitamins, minerals, and nutrients. And cholesterol is a building block. Essential fatty acids and cholesterol is a building block of hormones.
I just recently, with the advice of Dr. Bagnell, Dr. Michael Bagnell, who I
Sure.
believe is a friend of yours, he told us to all go get a vitamin D check. So I did. And the
Mhm.
results just came back a couple days ago, and it said my level, which I think I'm super healthy, but it came back my level for vitamin D was 29.
Okay.
So he says it should be 60.
Mhm.
Not that you're just, disputing what he says, but
Sure,
what is your
sure.
take on that?
Well, as far as they say, if we go out and get a couple hours of sunshine, of course, everybody wants to be careful of how much sun and sun damage, but our body can, build vitamin D. But if people are on cholesterol-lowering drugs, it depletes vitamin D and coenzyme Q10. So we tell them they definitely need to. I rather have them get away from the medicines when possible and lower their cholesterol naturally. But if they are getting low on different nutrients and they should supplement vitamin D. I usually have patients use an oral vitamin D3, the most usable form, and I usually have them take 5,000 units a day. Now, some people, if it's drastically low, they'll get a vitamin D shot, and that might be 50,000 units. So,
Okay.
but we like to do it orally when possible.
The liquid kind, which is the kind I
Uh,
got. I think it was 5,000, whatever.
Sure. Yes, we use it in a liquid form, and we also use it in a tablet that's very usable and bioavailable. So I'm very particular about nutrition companies and the quality of their products. I only use the top 5% of nutritional products. There are some good ones at health food stores, but people have to be careful. We use nutritional products that are normally supplied to clinical nutritionists or physicians, and they're very high quality. People
Okay.
will go and get a pharmaceutical supplement that's, I have patients bring in things all the time that are made by a pharmaceutical company, and unfortunately they make a lot of shortcuts. I like whole food supplements that are high quality and from organic foods and so forth. So I'm very picky or particular about my nutritional supplements.
Okay. And, our program today, as always, is educational. And I know you are aware of that. And we're happy to share the good news about education with the world. But at the same time, I want to let people know that they can go to your website and,
Sure.
and get pre-approved, good quality, no filler vitamins and minerals and whatever you have. What is your website, Dr.
Well,
Finucan?
well, my website mainly for the office, the website is www.mynapleschiropractor.com, chiropractor.com, mynapleschiropractor.com. And we have Weight Loss Done Right Naples is another website for our health and nutrition and weight loss centers.
And we'll have you come back another time to talk specifically about weight loss.
About that. Sure. As far as if somebody has a particular question, we can give them, detailed information, personalized for them about what nutrients they should take. And we do laboratory work and functional medicine testing. We can evaluate, like you said, you went and got your vitamin D checked. We can check a lot of those things with laboratory testing, but we also do applied kinesiology, and we can determine a lot of what the body needs without expensive testing.
Okay, great. And I know some of our listeners are from the Naples area, but we actually I think we have a viewing of almost 2 million people. Will be able to share this video and this education with other fellow groups that we have. But there's certainly some in your area, but they can also, I think, email you or go on your website and just order
their information. And Naples is a great health spa destination. They can come here and have a nice vacation and get some health care at the same time.
Okay, great. So question, when you're taking hormone replacement, I guess the birth control pill, for example, is a hormone replacement, I think. So if you're taking that, do you need to stop hormone replacement for any period of time to recover, to let your body take a breath? Or
if people are on hormonal medicines, of course, they have to be under the advice of how to stop those properly. They might need help with their pharmacist or things, or if they just stop taking birth control, of course, then what we can do is the therapy and nutrition we have actually rebalances the body more quickly so they don't get out of balance or don't feel bad. We've had women that had infertility and when they got off birth control, well, we helped balance the endocrine and hormonal system, and they felt better and they recovered, and then they were over the infertility problem. So yes, coming off of those, sometimes it takes a little time to bring the body into balance. We can help that happen more quickly.
Okay, great. Next question. Women that are breastfeeding, can they still take the birth control pill?
I'm not sure as far as with breastfeeding. I tell people try to take the least amount of medicine, but normally if a mom is nursing, the body normally would be less likely to get pregnant. The body has wisdom, and when somebody has a demand on their body, but nothing's a fail-safe. So as far as, but I don't recommend women take any medicines that they don't absolutely have to take while nursing. And so
okay, makes sense.
I try to do the natural things.
Okay, let's talk about menopause a little bit. Perimenopause, premenopause, and menopause. I know all of that. So what do you have to say about hormones and menopause?
Well, menopause is a natural occurrence, but some women go into menopause because of things that are missing, or for example, they have a hysterectomy and ovaries removed, that it can put them into immediate menopause. That's the lowering of the female hormones, and then they can get hot flashes and lack of healing, bone density problems, irritable, tired, all kinds of things. So again, we would do the best things nutritionally to help their body to function better and feel better. I've had women that we put them on the optimal nutrition and it stopped their hot flashes and they felt wonderful. I've had women that we put them on that nutrition, they stopped hot flashes, but they started having their menstrual cycle again, and they said, can we get a balance so that I'm not getting so youthful that I'm having cycles again, but I still feel good and don't have the hot flashes? So we try again to bring things into balance.
Okay. I asked a member, at least one member, if they had any questions that they would like to ask you. And here's a question from one of our members. She said, does hormones, lack of them or too many of them, can they affect your personality? Good question.
Sure. Well, like I said, hormones have a lot to do with our mood and emotion. So if they're out of balance, you can get more irritable or tired. It affects our joy. And so if your hormones are way low or way high or out of balance, it can cause problems. Yes. It affects your energy, your mood, and your healing. So it can
That's
greatly
important.
affect our personality.
Yeah, because all of us at certain times of life feel a little sluggish. Maybe we don't have enough energy or a lot of energy, and it could be just because we accidentally had our hormones in sync or didn't have them.
Right, it could be out of balance. Adrenal fatigue is, like I said, the adrenal gland is part of the hormone backup, and it helps the heart and kidney, and it's the stress gland. Too much stress, too much sugar, too much caffeine, the adrenal gland gets shut down. So we see that all the time.
How can we clean our, sounds like a strange question, but how can we clean our adrenal glands?
Well, as far as we tell patients, definitely go easier on refined sugars and junk food, easier on caffeine. Those are the two big things. That and stress are the three biggest factors that exhaust the adrenal glands. We use, again, nutrients. If you Googled adrenal fatigue, most people would say, wow, I have that often. It affects their blood pressure, their energy, their all kinds of things. The adrenal glands help get rid of inflammation. They make your natural cortisone. When the adrenal glands aren't right, you get more susceptible to allergies and asthma. So we'll use, if you looked up nutrition that helps adrenal glands, it'll list maybe 20 or 30 different things. Well, what we do is use an adrenal supplement that has all 30 things in one supplement, so you don't have to go to the health food store and buy 30 things to try to balance the adrenal glands. But if you lower stress, sugar, and caffeine, and we balance the adrenal glands with an adrenal supplement, people will function and feel better very quickly.
So let's get it right here. Low on the coffee, right?
Yeah,
Low on sugar.
Easier on sugar, and we'll try to reduce stress.
Lower stress.
One of the best things, other than happy and vacation and so forth, we use a full body magnetic. It's called the Magnosphere, and they've proven it lowers cortisol levels, the stress hormone, and it dramatically reduces anxiety and stress. They're using it for veterans for post-traumatic distress disorder, and it calms the stress and speeds healing and circulation. So we have the best stress therapy here, other than a vacation.
I want to have a program just on the Magnosphere, if you don't mind. But can you just, I don't want to too much focus on the Magnosphere, but can you just give us a 1 or 2 sentence to tell us what it is? Because we're sitting at the edge of our seat waiting to hear.
Well, it's the most advanced full body magnetic therapy developed by Dr. Jerry L. Jacobson. He's the most brilliant physician I've ever studied with. He's just amazing. And it has 415 programs or protocols for every part of the body to speed healing all naturally with gentle magnetic fields. So we'll do a show on it sometime. It's pretty amazing.
Let's do that. So we'll get back to that, but at least you got us intrigued. And I'm sure on your website it has a little bit about the magnetosphere.
Yes, all our therapies. Yes. Yeah. If they click on it, they'll list all our therapies and what we do. And there's a little information on each therapy that we utilize.
Okay. So let's get back to hormones. So here is the big question. So exactly how do hormones affect our weight? Too much weight usually. Sure.
Well, like I said, they'll actually put livestock on hormones to put weight on them. So if we're consuming all these foods that are loaded up with hormones, it can help. It can affect our metabolism, and it can make the body put weight on more easily. So again, we want to try to avoid some of the things that are artificial and pushing hormones into our body.
Okay, so we got to look at the meat,
so
mainly meat.
Hormones affect our metabolism. Yes.
Oh my gosh, that's what's wrong with me. Maybe I'm eating too much meat that I'm not making sure that's organic. I need to make sure it's organic.
Yes, that helps. I love seafood. I try to get wild caught fish, but I do eat some chicken and turkey. Of course, Thanksgiving around the corner, but I do eat meats. But I try to get higher quality and, like I said, range free, antibiotic free, hormone free. And there's more and more of that even in the general stores because people are demanding it.
I don't think they put hormones in other foods like vegetables or a drink or almond milk. I don't think hormones.
No, I don't think those are generally added. Of course, there's a lot of other additives, chemicals, high fructose corn syrup, other chemicals that can cause imbalances in our body and how it heals and functions. But it's mainly in domesticated animals to put weight on them, and antibiotics are used widely, and hormones are used a lot as well. So try to choose and find sources that don't have those additives.
That's great. And then when we do our program about your weight loss done right
Sure.
office, your
Sure.
practice, actually, we'll talk more about that. What
Great.
about hormones and headaches? Does a hormone imbalance cause a headache?
Well, it can cause such a wide variety of symptoms because it has to do with our energy and our mood and our healing, the body's ability to heal and repair. So it's possible. A lot of women will have headaches at certain times of their cycle because of fluctuations or imbalances in hormones. And in 37 years, we've never had patients with migraines or headaches that we didn't improve, but sometimes we improve them by balancing their hormones. Sometimes there's other causes of their headaches or migraines that we can readily help.
Okay, so I know we're getting into a half hour here, so I wanted to kind of wrap it up and get a little summary. So again, a lot of the ladies and men watching, up to maybe 2 million in other groups that we're members with, they're all over the world. So we all can't come down to see you in Naples, Florida, although we would love to see your brilliant and beautiful office. So what can we do on remotely with you? Or do we need to go to a doctor near us?
Well,
And what do they need to say? I just want to get tests
sure.
done.
Well, we try to help people find very good nutritional practices and so forth. We've done phone consultations. We've helped people order laboratory or help them with diet. So we've done some consultations remotely. We try to get people to come in when they can. If they really are in need, we try to help them find a holistic physician that does clinical nutrition and does the best to help them heal and recover. I know quite a few all throughout the US. I don't know a lot in other countries, some, but at any rate, we try to help them find good help.
Okay, so they can go to your website, which is, what was it again?
MyNaplesChiropractor.com.
Okay,
is our main
and they
site.
can also call you. What's your phone
Sure.
number, Dr. Finucan?
Yeah, the phone number here is 239 area code, and it's 592-7767. That's and it's also, of course, on our website.
Right. I'm suggesting that everybody watching, if you do have questions about hormones, which I suggest you check it out because I just did and mine were off, call and leave Dr. Finucan a message, even if you're in another area, and he will refer you to a very reliable doctor.
Sure.
Otherwise, if he can't help you on his own down there. So did you have anything else you'd like to say?
Well, just thank you, Trish, for having me. We look forward to doing some other great health topics in the future. And everybody have wonderful holiday season. I'm going to eat some turkey, but at any rate, I'm going to try to get good quality. But no, I just had a great time visiting with you today and discussing some women's issues, and of course, men and women, because both need balancing in their endocrine and hormonal system.
Thank you, because we've really been looking forward to really, from an expert in this field about hormones, we're so excited to have learned from you because we trust you, Dr. Finucan, and that's important.
Thanks, Trish.
Thank you. Okay, well, we will schedule to have you back again and have a great holiday.
You too. Thank you.
Thank you. Bye-bye.